My name is Sonya Koenig. Right now my biggest hobbies are playing with my grandbabies, enjoying time with my littles. My childhood, I struggled quite a bit with weight loss. I was always kind of the chubby kid in school, got teased quite a bit for it. After I had my children, I started picking up weight slowly but surely, and got up to close to 400 pounds. It just seemed that the weight kept picking up. I had some stress factors in my life that occurred, and I think the depression from some of that caused some stress eating. Met with Dr. Reese initially, Jared Reese. He just kind of laid it out straight that if you stay at the weight you're at now, you'll have maybe 10 years to live. About 10 years from now, my grandkids won't even be fully grown yet, and the thought of that just frightened me. I decided that I have to do something, and so Dr. Reese gave me a referral to Dr. Eisenschenk. And what an amazing guy. I absolutely love Dr. Eisenschenk.
Sonya came to our clinic having struggled with really a lifetime of obesity and metabolic illness. She came seeking a sense of hope, of support, and of expert medical guidance to support her on her journey to improved health and wellness.
He just sat and listened, was very caring, very empathetic, and he believes in me. He made me feel like he was on my team and that together we're going to do this. All of the fad diets, they all failed for me in the past, and so I was trying to find something that would just be not a diet, but that would actually change my way of thinking. And he was able to give me that.
Many or all of the diseases or diagnoses that Sonya developed throughout her lifetime are branches of a similar tree, and that tree is metabolic illness, insulin resistance, metabolic syndrome. And having someone like us see her through that lens, not as you have 9 different things with 9 different causes that need 9 different pills or surgeries or procedures, but a kind of simplified root cause focus that unifies kind of all of what she has struggled with, and also in doing so, as her case exhibits so well, can put into remission or, I would say, cure many of those processes as well.
And he put me on a keto diet, and as I would have difficulties, I would discuss the difficulties that I was having with him, and he would offer me suggestions and ideas. We modified the diet a little bit. I had a hard time losing all my fruit. That was one thing that I really had a difficult time with, and he said, okay, well, what we're going to do is we're going to just have a little bit of fruit. We'll just modify it to that and keep your portions down, and it was very successful. Since I've started with him, I'm down 125 pounds, and I feel amazing. My energy level has skyrocketed. I'm up vacuuming, I'm cleaning, I'm doing other things that I would sit in my chair and think, oh, I really need to get up and do that, but I just don't have the energy to do it. Now I do. I'm able to get on the floor, get up and down on the floor. Little things that people take for granted that, you know, when you're overweight, you can't do. It's just so amazing to be able to do those again. Dr. Eisenschenk has just changed my life, and I'm just really excited to stay on the journey.
I tell anyone and everyone that meets us who may have hesitancy about being vulnerable with a program like us, stepping into this space, talking about their weight, give us 90 days. And at that point, if you don't feel like we've made meaningful improvements in the areas of how you feel about yourself, how you maybe look to yourself, how your labs look, how your measurements are, and by the way, the number on the scale usually follows suit when all those things are aligned, then I'm open to reconsidering. So far, that hasn't happened.
I didn't want to be an embarrassment to my kids. And so probably my biggest regret is not having done this sooner, because then I could have maybe better been an example for my kids so that they also wouldn't struggle with weight loss and dieting and healthy eating. I wish I would have been a better example back then. I didn't know myself how to do it, so I wish I had met Dr. Eisenschenk many, many years ago, but I'm a much better grandma because of it. And we have strawberries and blueberries and things that the kids enjoy, and I want to try to be a better example for them. I'm proud of myself. I feel good about myself.
You're just too fun.